The Rocky Mountain Youth Clinics started in the early 90s when Dr. Larry Wolk saw some limitations in public health care and private practices trying to serve uninsured children. After seeing the need in health care offered to uninsured and public insured kids, Dr. Wolk was inspired to start the Rocky Mountain Youth Clinics. He started with a single clinic.
So when I started the Rocky Mountain Youth Clinics, my mantra was that this was going to be a private practice of public health model. And so patients appreciate the level of respect and the high quality service that's provided here, very much on a line with what a private practice would provide, but we don't turn anyone away, regardless of their family's ability to pay.
In Colorado alone, experts say there are approximately 180,000 uninsured children.
Within a few years of starting my practice, I realized that there was a greater need than I originally thought. So I went ahead and pursued getting our practice incorporated as a nonprofit organization.
Turning the Rocky Mountain Youth Clinics into a nonprofit enables it to receive grants and raise funds to lower health care costs and to multiply its locations to serve a large percentage of the uninsured population. The Rocky Mountain Youth Clinics now has 3 main clinics in Denver, Thornton, and Aurora, and more than 30 satellite clinics throughout Colorado. In addition, the Rocky Mountain Youth Clinics, in partnership with the Ronald McDonald House, has 2 mobile clinics offering medical and dental care.
We have the mobile clinic, which goes to several schools here in Aurora to increase access to healthcare to uninsured kids. We see kids, newborn infants all the way up to age 21 for $10 a visit. We can do their child exams, sports physicals, illnesses, and we also deal with a lot of behavior issues since we're here in the school-based clinic. And it's all about increasing access to healthcare for kids who don't have health insurance.
Rocky Mountain Youth Clinics is one of the largest providers for healthcare to serve the uninsured children population in Colorado. More than 30,000 kids visit these clinics in a single year, with more than 50,000 patient visits, 50,000 immunizations, 10,000 newborn babies' first exams, and 5,000 school-based clinic visits a year.
And a school-based clinic can be anything from a small room to a larger classroom where we set it up as a medical exam room. The children then receive their health care on site, allowing for parents to do a permission slip, if you will, ahead of time. If the child is sick, they can be treated right there at the school property or go to a surrounding school that might be close by.
The Rocky Mountain Youth Clinics is a combination of health care and services. Its goal is to get kids healthy and keep them healthy. Some of these services include a food and clothing program and a reading program.
Studies have shown that kids that read tend to do better in school, tend to be in better health, and so we were one of the first programs in the country to actually adopt this Reach Out and Read program to provide books and promote literacy in our patients.
We provide a book for all children ages 6 months to 5 years of age. They receive a new book and all of their well child checks. And if they come with brothers or sisters or cousins or neighbors, whoever, we make sure that every child that leaves the clinic does go home with a new book or a gently used book.
We have a snack shot program that we started about 3 years ago, and it's in cooperation with the Food Bank of the Rockies, where we purchase food at a very reduced rate and then put together small gallon baggies of different snacks that we can give out to the kids and the families to encourage healthy eating habits. So it not only allows them some food, but it also gives them some healthy food habits that plays into and works well with our weight management clinic as well.
Some of the other services offered in these clinics include an asthma clinic and a smoking cessation program.
Asthma Clinic is an opportunity for us to just give extra time with devices and medications and plans for kids who have asthma. So we give them hour-long appointment times and really have a chance through multiple providers and nurses to go over and answer questions and get their asthma as well controlled as we possibly can.
We have a new smoking cessation program that is interesting in that it mostly targets the parents of our children. We still talk to teens about their smoking, but we have a bigger audience in the young parents that are bringing in their children, and an alarming proportion of them smoke. And that smoke gets to the kids. Even if the parents say they're smoking outside, they still have it in their clothes and their hair. They bring it to the children. The children have more colds, more ear infections, and asthma, of course, and respiratory diseases are worse with it. So we're targeting those parents to talk to them about their smoking. And they're not our patient, but they are a part of this child's world and a very important part that can have a huge impact, potentially a negative impact on the child. So we ask them if they smoke, we advise them about the hazards of it, and we refer them to the Quit line. And this potentially can have a tremendous impact on the child's health and the entire family's health as well.
Buenos días, bienvenidos a la Clínica Rocky Mountain Youth.
The Rocky Mountain Youth Clinics serve a diverse population of children from all over the world.
We've made efforts to make our clinics more welcoming to people from different backgrounds, so we've ordered posters for all the clinics that have different, famous people, inspirational people from different backgrounds. In the Aurora Clinic, we love our map probably the most because it's just one way that we found to really embrace and celebrate our patients, because as you can see, they come from all around the world.
With each new clinic, all the patients' records are in an electronic format.
It's important because we no longer have to use paper charts, and because of our 3 clinics, let's say a patient can't get an appointment there and they want to come to us. We can see them without having to transfer their paper chart, and it's easier for us to know what's going on with the patient because it's all in electronic medical records.
Rocky Mountain Youth Clinic, this is Lupe. How may I help you?
I know one of Rocky Mountain Youth's greatest asset is the people who work here. We have now over 60 employees, all of whom choose to come to work for us and really embrace and dedicate their working every day to our mission, and without them we would not be as successful as we are.
So, we try to run the Rocky Mountain Youth Clinics like a business. We have a very efficient operation. We don't have much in the way of overhead. Having said that, because we see families that have no insurance and can't pay or are insured through public insurance, we obviously have to operate at a deficit. I'm proud to say that we generate about 65% of our operating dollar through third-party payments, like through Medicaid or through insurance, but that leaves about 35 cents that we have to raise through fundraisers, through private grants, through community foundations. And we're very fortunate because many of the foundations throughout the state and many businesses throughout the state recognize the value of the service that we're providing and really do help make up the difference. It's allowed us to expand our programs. It's allowed us to actually now start building larger clinics that can see more kids. So really, the more money we can raise, the more kids we can serve.